Hi everyone, thank you so much for joining us today. My name is Jessica Flint. I'm the Health and Nutrition Advocate at the Center for Civil Justice. I'm joined today with our Executive Director, Kelly Beidelman, to talk about the public health emergency unwinding and how it may affect your Medicaid coverage, how to make sure you keep your benefits, and also about our free helpline. But first, Kelly, could you tell us more about the Center for Civil Justice?
Sure, Jessica. The Center for Civil Justice is a nonprofit organization that advocates on behalf of people living in poverty. And we work to advance racial justice in everything that we do. Our priorities are health equity and housing equity. And we do our work through impact litigation, legislative lobbying, policy advocacy, and education and awareness campaigns.
Great, thank you so much for sharing. So we're here today to talk about the Public Health Emergency Unwinding, or PHE. We're really concerned that people who remain eligible for Medicaid benefits are going to lose them during this process. Could you tell us more about the PHE unwinding?
Sure. During the COVID-19 pandemic, the federal government declared a public health emergency. And they were concerned and wanted to make sure that people will maintain their Medicaid coverage throughout the end of the public health emergency, especially because low-income people are more vulnerable to the impacts of COVID-19. Mm-hmm. So the states could opt in, and Michigan did, to receive a higher federal assistance level. Mm-hmm. And in exchange for that, they agreed to provide continuous coverage of Medicaid throughout the entire public health emergency.
Oh, excellent.
Yes, and it also allows for free treatment and testing for COVID and some other protections. So people that have been on Medicaid for years know that every year they have to do an annual redetermination to update their eligibility to make sure they're still eligible for the program. And because a lot of people have joined Medicaid since the start of the pandemic, they don't know. They're not used to that process. So the state's going to be going through over 3 million cases to check eligibility on people. And they're going to be sending out a renewal form, and if people don't complete it and return it, they're going to lose their Medicaid. So the state started with the June renewals, and the redetermination is going to go through the end of May 2024.
Okay.
So do you want to talk about how the process works?
Definitely.
All right.
So people, 90 days before someone's renewal is due, they should receive a notice from MDHHS. It's an alert letter that is telling them they have an upcoming renewal, and that they need to make sure that their contact information is updated with MDHHS. They can do this by logging into their My Bridges account, or they can contact their local office to make sure that they have the correct contact information. Mm-hmm.
Great. So are people not aware of this, or are they not receiving notices?
Yeah, so some of these notices are the renewal notices. They have to complete them and submit them to their My Bridges account. And no, some people aren't aware of these, that this is happening. One young man who called me, he told me that he thought he was still eligible for benefits, but he had moved and didn't update his contact information, and he didn't realize that his deadline had passed until it was too late. He had already lost his benefits. We're especially concerned about how this could affect the most vulnerable communities that are, at highest risk of adverse health outcomes or suffering from long COVID. it's estimated that 15% of Latinos on Medicaid will be the ones who lose their benefits. So we're just worried that these populations, they're gonna not find out that their benefits have been cut until they go to the doctor or the pharmacy and they receive a bill instead of their prescription.
Oh no, that's not good. Is the department sending out this notice, this renewal form, in an envelope? I remember during the work requirements that they were going to do for the Healthy Michigan plan, and they sent out this really colorful envelope. It said, open this is really important mail. Are they doing that?
That was a great tactic MDHHS used. Luckily, they were able to make sure the work requirements didn't affect the Medicaid coverage. But in this instance, they're not doing that. So it's really important that people check all of their notices from MDHHS. I know sometimes those notices can get, people just think they're junk mail, they may toss them. So it's really important that Medicaid beneficiaries open any notices from MDHHS and complete any forms they're sent and submit them or return them to their local office.
All right. That's good information.
But not everyone will receive a renewal notice, right?
That's true. The department is going to be doing automatic renewals. They're also called ex parte or passive renewals. So there's certain categories of Medicaid. For instance, there's Medicaid for pregnant people, or there's a Medicaid category for people that are under the age of 19. If the department already has information that a person is still eligible for Medicaid, they're going to automatically renew them.
Okay.
They also have data sources that they're going to be looking at, such as the Social Security Administration or the Unemployment Insurance Agency. And if they have those data sources, they can also see that people are still eligible. So those people will be automatically renewed, and they're supposed to receive a letter letting them know that that has happened. I also wanted to note, for people that are undergoing life-saving treatment, such as chemotherapy, radiation, dialysis, immunotherapy infusions, Michigan Department of Health and Human Services has announced that those renewal months are going to be put to the very end.
Okay.
So those people won't have to renew until May of 2024.
Okay.
And I also wanted to note that before a person is terminated from coverage, the department has to look at all the other categories of Medicaid to see if they're eligible under another category. And what do you think, what if somebody misses the deadline and doesn't turn in their renewal packet?
Yeah, so if someone misses their deadline, the state of Michigan has announced a flexibility that allows for Medicaid beneficiaries an extension, a 30-day extension to submit their documents. So if their renewal is due in May, they won't lose their coverage until June.
Okay.
They've also, limit how many people lose their benefits. They are allowing people to submit a redetermination. If they do it in 90 days past their deadline, they can get retroactive coverage. So they can do that, or they can, if they submit a new application, that can also be used for 3 months of retroactive coverage.
And what about the people who aren't eligible anymore? They got a full-time job, they make too much money, they were able to obtain employer-provided insurance coverage, or they're just not eligible for other reasons. What's going to happen to them?
So definitely that those will happen. A lot of people are employed now that weren't during the pandemic. So in those instances, DHHS will refer them to the health insurance marketplace, and there they have a lot of different coverage options, some for as low as $10 a month. So it's really affordable for people to find a program that works for them.
All right. And where will they find these marketplace navigators?
They can find if they need a marketplace navigator, someone to help them with the marketplace, they can locate one on the MDHHS website.
Great. So let's talk about our Health Eligibility Law Project, the helpline that you run at CCJ. What are you able to do? How are you able to help?
Yeah, so I am a trained MyBridges navigator, so I'm able to help people, create a MyBridges account, also to submit an application along with any documents that they may need to submit. And if people have questions about eligibility or about, say, their benefits are denied and they're unsure why, I can help them work through those problems. And while I do a lot of Medicaid, especially right now with the PHE unwinding, it's also for programs like food assistance, also known as food stamps or SNAP benefits. I can help people enroll with that, or the SER benefit, which is state emergency relief. It helps people with things like if they need help paying for their consumers or water bill, or for cash assistance for low-income families and also for refugees within their first year of living in the United States.
That's fantastic. Now, can you help people statewide with all of these services?
Yes, for a lot of the services I can, but to help someone create a MyBridges account and to submit an application, it does need to be in person. So someone may want to, connect with someone more local to them, and they can find a MyBridges navigator near them by going to the MyBridges website. If you scroll all the way down to the bottom of the page, there's an option to connect with a community partner. You type in your address, and it gives you a list of MyBridges navigators near you.
And you're also able to help people in Spanish?
That's right. Se habla español. Si necesitas ayudar con tu renovación, llámame a las 810-238-8053.
Great.
And thank you so much for joining us today. We hope you're able to retain your Medicaid coverage during the public health emergency unwinding.
All right. I thought you did a